Hello, I hope your first clinical rotation is going well. The clinical team wanted to reach out and give you a brief message about expectations for scheduling for the rest of the clinical year. So you've done it. You've successfully transitioned into clinical rotations. It has definitely been a hard year. You've been asked to do what few students have been expected to do, and that's to deal with the disruptions caused by a global pandemic. So we want to thank you for your ongoing professionalism, flexibility, and patience with all of the complications COVID-19 has created for you in impacting your education, especially during your clinical year. Initial panic and uncertainty of the pandemic has calmed a bit, but there are still a lot of questions unanswered and complications expected ahead. I think it is reasonable to expect more glitches, more delays, more inconveniences, but only time will tell. We are grateful for the victories, both big and small, that we have experienced during this trying time. This includes rescheduling Skippy experiences and redesigning curriculum that allowed the C20 cohort to graduate on time, and for the opportunity to keep your rotations on schedule so far. We are so grateful that everyone was able to begin their first rotation, and we are indebted to our generous community partners and thankful for gracious students. As we approached your clinical year, we were cautiously optimistic that the major challenges caused by COVID-19 were behind us. Jennifer has successfully managed to schedule nearly 60% of all clinical rotations for the entire year, and we aren't even done with rotation 1 yet. Many hospital systems and groups have reopened to students, but there are still complications interfering with the regular functioning of clinical rotations. In order to maintain expectations and offer full transparency, we want to update you on what you can expect from the rest of the clinical year as it pertains to scheduling logistics. It is a possibility that at some point you may be required to quarantine. This may be due to community or state regulations, possible COVID exposures, or site requirements. One of our main hospital systems, Intermountain Healthcare, for example, has recently added new, more concrete COVID policies in which we will have to be conscious about while scheduling. One of these policies is mandatory quarantine for those who are traveling from out of state. This is particularly relevant for those of you traveling out of state to rotation sites or traveling for Thanksgiving and December holidays. So far, students have been diligent about contacting us immediately if they have reason to believe they have been exposed to the coronavirus. Some students, and we expect more, have had to quarantine to protect the safety of those around them. This is a necessary precaution, and we will work with students to minimize the impact as this happens. We will continue to communicate any site quarantine requirements we are aware of as they apply to you. Please take responsibility to follow the required protocol and plan your dates accordingly so you may begin your rotation after breaks as soon as possible. If you have any questions or concerns about quarantining, please reach out to us. Overall, please just recognize that necessary quarantine requirements may delay or interrupt your clinical rotations. This is not ideal, but it's what it takes to participate in clinics right now. In regular times, paperwork can be a hang-up for many rotations. Unfortunately, with the coronavirus, it seems that paperwork is taking much longer in some cases than normal. In many cases, this is due to smaller staff or reduced office hours, additional requirements, ever-changing responses to COVID, and difficulty getting approval from administrators. Summer is very skilled and diligent and will work with you with any of your paperwork requirements. Still, despite the best preparations, sometimes paperwork delays are inevitable at this time. It is also possible that we may be waiting on new affiliation agreements as well as we reach out to new sites and providers due to limited access to rotations during the pandemic. We are widening our scope. We are widening our reach to new potential preceptors. Please be patient and understand that some rotations may be delayed due to increased paperwork delays and affiliation agreement complications. Although we have been pleasantly surprised to have found so many community partners willing to host students at this time, the clinical team is approaching a point where clinical rotations are getting more difficult to find and schedule. This is a regular and predictable challenge of the job. However, Please be aware that there are still many clinics, hospitals, and groups that are limiting or restricting student participation in response to the coronavirus. Some are simply resistant to scheduling any rotations until there is more certainty on the direction of the virus. Others are simply saying no to everyone for the foreseeable future. And there are also many sites that have agreed to take students only to change their minds about accepting them. There's no way to predict what the availability of sites amid COVID-19 will look like, and we all cross our fingers that most systems will continue to stay open for student training. While so far most students are on track to have consistent full 5-week rotations, we do not want to make any promises that we may not be able to keep. It is becoming more clear that with the coronavirus, it is likely that as we approach the last 40% of scheduling, there will be a shortage of clinical rotations. And as we just discussed, there are multiple other factors that may delay or interrupt regular rotation schedules. Unfortunately, it is probably unrealistic to expect little to no disruption of clinical rotations during this challenging time. So what does this mean for you? We ask that you please be grateful when you have a full rotation, and on the other hand, be flexible and patient if your rotation more closely resembles those of the previous cohort, that is, shorter and maybe even broken up into multiple experiences pieced together. Expect possible delays, expect complications, expect it to look a little messy, but you can also expect to learn what you need to know and to meet your educational learning outcomes. Fortunately, we expect any amendments to rotations to impact fewer than 40% of upcoming rotations. With the remaining referrals and scheduling electives, which we've not done very much yet, we are optimistic that that number will be much lower, with potentially impacted rotations primarily being in pediatrics, women's health, and emergency medicine. But again, we have no idea what fall and winter will bring. It is important to remember that our focus for your clinical year is on skippies and not clinical rotations. You can and are expected to gain clinical experience for multiple patient encounter types during each clinical experience you have. Remember, it is possible to participate in prenatal or gynecological care in the emergency room or in surgery, and you will certainly encounter behavioral medicine in every setting. And just like you may encounter pediatrics or pre- or post-operative care in family medicine. Please continue to track your encounters carefully in Exact and be thorough in your Skippy outcome assessment assignment that you'll complete at the end of each rotation. In the case of any less than ideal clinical experiences, these tools will serve as valuable proof of your competency and preparation as a future provider. Despite some of the unique challenges that may lie ahead, we are optimistic for the future and hope you are too. We are a team, working together to accomplish a common goal, and we believe we are all the right people to step up to this challenge. It will be a pleasant surprise if we can schedule and successfully complete all clinical rotations, but in the case that this is not possible, let's be ready for anything. And a note about referrals. If you have contacts for potential preceptors that you have not submitted, yes, we are still interested in them. But please reach out to the clinical team before you make any contact to ensure the referral is one we can actually use and is also not someone we have already reached out to. Thank you for all you do, and as always, feel free to reach out if you have any questions or concerns.